Good afternoon, everyone. Good afternoon and welcome. Thank you so much for joining us today. It's an honor to celebrate this milestone for the new Wake County Public Health Center in such good company. I am Shanika Thomas, the Wake County Board of Commissioners Chair. We might think sometimes of a groundbreaking ceremony as the beginning of a project because it marks when new construction will start coming out of the ground, so to speak. But it's really a moment to look back and honor the years of hard work and collaboration that brought us here. The idea for this new public health center grew out of the experiences of our health and human service staff, as well as the 20-year Human Service Master Plan that the board adopted in 2017. Not only did we need updated facilities, but the space needed to match the philosophy of our work, a space that encourages easy access to multiple services for a more holistic approach. Each component of health and well-being is interconnected. It only makes sense that the health supports we provide should be interconnected too. I'd like to recognize some of the people who brought us here today. First, thank you to Team Wake for all of your hard work. Our Human Services Director, Nanette Bowler, who we'll hear from shortly, and her whole Health and Human Services team. You've done a fantastic job reimagining how we can do better for our community. Thank you also to Deputy County Managers Dwayne Holder and Emily Lucas, as well as our County Manager David Ellis for your leadership in this process. Thank you to Mark Fostieri and the whole facilities, design, and construction team. I know this has been a big lift, and your dedication is clear. The Health and Human Service Board has also provided crucial leadership for this project. Its members represent many of our key community partners dedicated to advancing public health, and we couldn't do it without them. Thank you to O'Brien Atkinson Associates and LS3P Associates, our architects and designers. Their ability to turn our community needs into a cohesive, efficient, beautiful design is inspiring. Also, thank you to Skanska, our contractor, and the team turning those gorgeous plans into an exciting reality. I also want to thank Congresswoman Deborah Ross, whose hard work in Washington helped us secure important federal grant funding to make this happen. We are so grateful for your partnership and support. And we're also glad that you could celebrate with us today. Also, I'd like to recognize my fellow commissioners for their time, hard work, and many, many, many questions that led us here. Please stand and be recognized. Vice Chair Evans, Commissioner Stallings, Commissioner Adamson, Commissioner Mile. There is one commissioner who is not here today, who profoundly shaped this work, who I would like to honor. Dr. James West passed away last month. And it's really tough standing here today without him, knowing just how proud he would be. He served as the Health and Human Services Committee Chair for years and was a lifelong advocate for people society might call the least of these. You didn't need to know Dr. West for very long before he would teach you about the social determinants of health, or he would extol the county's shift to an integrated human services model. Through Wake County's growth and prosperity, he constantly spoke up to ensure that the rising tide did indeed lift all boats. And it's through sadness that he's not here with us today in body, but I know that he's here with us in spirit. This is one of the many places that his legacy will live for generations to come. Okay, so I know some of you are eager to get your hands on these shovels that are waiting for us, so we'll keep the program moving. Vice Chair Susan Evans is not only an excellent chair for our board's education committee and our go-to transit leader, she's also another commissioner we trust to ask tough questions and to elevate our work. I'm incredibly lucky to work with her as a board leader. Please give a warm welcome to Vice Chair Susan Evans.
Well, thank you, Chair Thomas. And you know, there's been lots of meetings, lots of discussions, lots of reviewing schematics and plans, and it's so exciting to finally be here today to get things rolling on this wonderful facility. You know, as Wake County shifts how we work in the public health arena, it's crucial that we have the right facilities to support that work. As Board of Commissioners, it's our job to make sure that Wake County is a place where all of our residents can thrive. Nothing is more foundational to a person's ability to thrive than their health. This public health center will anchor our Health and Human Services campus, which was designed to be easily accessible to everyone who needs it. We'll have a full parking deck complete with electric vehicle charging stations and solar panels, and there'll be an easy drop-off location to help folks with limited mobility. The whole campus is also near public transportation, including our first bus rapid transit route, which is beginning construction along New Bern Avenue. Once community members arrive here, the campus will be easy to navigate. Walking paths, clear signage, and access to the social services building as well. There'll be public art and lush, drought-resistant landscaping that will also help set a tranquil tone. Really important will be the bright and welcoming feeling of the first floor of this building. It will have warm natural materials and a very clear registration area to prevent confusion and overwhelm, which we haven't had in our previous facility. The large central waiting area will be comfortable and calm and setting the stage for compassionate care. The exam rooms and service areas will be flexible, so staff can adapt to changing community needs while the flow of the building is strategic. Anyone with kids can appreciate that navigating stairs with fussy toddlers or a stroller is not a great way to kick off a trip to the doctor. So with that in mind, we have the pharmacy and the women's and children's health spaces all on the first floor. This is the biggest and most comprehensive building project Wake County will complete this decade. The emphasis on thoughtful design isn't just because we want the space to look pretty, though it definitely will. It is important because it will impact people's health. We can have all the outstanding providers and all the state-of-the-art of equipment, but it won't matter if people aren't comfortable coming here. So if it's difficult to get an appointment, if you feel unwelcome when you arrive, if logistics are stressful before you even speak with a provider, you're much less likely to come back. And missed preventative care appointments and interrupted treatment have big consequences for people's health. So as someone who's spent years in the construction industry, I deeply appreciate the care that went into this public health center design and the construction that will come forward, and the whole Human Services campus for that matter. It was an extensive team effort to get to this point, and I'm incredibly proud of this team. Next, we will hear from our great team member, whose partnership we appreciate so much, Congressman Deborah Ross, who dutifully serves North Carolina's 2nd Congressional District, which includes more than half of Wake County. Please help me to welcome Representative Ross.
Thank you so much, Susan, and of course, the wonderful chair of the County Commission, Shanika Thomas, for your setting the stage for this amazing day. I also want to thank everyone here for joining for this groundbreaking. This is an important thing for the health, for the safety, and for the welfare of all of our citizens. Today marks an exciting milestone in our state's long journey toward more affordable, accessible health care. And I know that transformational projects like this one don't just happen overnight. I'm incredibly grateful for the inspired vision of our dedicated healthcare professionals. If you're a healthcare professional, please raise your hand. Our community leaders and our local residents who work so hard to make this day possible. Last year, I secured over $26 million in federal funding for projects across Wake County, including $2 million to help construct this new public health center. Where's the check? There's the check. These community-driven investments were developed by the people of Wake County for the people of Wake County. And one of the key pillars of public health is preventative care. Understanding that promoting the health and well-being of our community is not just about treating illness. It's also fundamentally about identifying and addressing the root cause of health disparities. Once open, this new facility will serve residents from all backgrounds and all walks of life. From seniors in need of vital cancer screenings to young moms seeking more information about pregnancy and parenthood. Wake County's team of experts will deliver exceptional care to some of our most vulnerable and underserved communities. By investing in preventative services, we can empower individuals, promote healthy living, and reduce high mortality rates in some of our county's historically marginalized populations. Indeed, today is a testament to Wake County's unwavering dedication to fostering a community where everyone can lead healthy, happy, fulfilling lives, regardless of their background or circumstance. And as we prepare to turn the dirt and then open the doors of this health center, let's continue to work toward a future where everyone in Wake County can access the care they deserve. North Carolina just marked a historic milestone by becoming the 40th state to expand Medicaid. Alongside many leaders, especially our governor, I've been fighting for Medicaid expansion for more than a decade. This achievement also would not have been possible without the billions of dollars in federal funding in the American Rescue Plan that incentivized our leaders to act. Just like working for funding for this new public health center, I fought for the Medicaid expansion because I know that North Carolinians are tired of waiting for accessible care. Again, I want to extend my deepest gratitude to everyone here. And I want you to know that we are all committed to bettering our community and making sure we're more healthy. Now I'm going to turn it over to an amazing leader, Nanette Bowler, our HHS leader, and she navigated through COVID, and she is going to bring us into the future.
So, good afternoon, everyone. Thank you, Congresswoman Ross, and thank you, everyone, for joining us in this very exciting event. I do want to take a moment to recognize my staff, starting with, and if you'd stand up as I introduce yourselves, Rebecca Kaufman, our Public Health Director, and then her team, Kevin Harrell, Michelle Wardell, who just stepped out. Oh, there you are, Michelle. Okay. Tony Johnston, Dr. Luderman, Janelle Mayer, and Tina Payton. And I also want to introduce Deb Baker, because as an executive assistant, you hold up the fort. All right? And then any of our other, if you would all stand, our public health and social service staff that are here today. Yes. Thank you. And I'd also like to recognize members of our Health and Human Services Board. We have with us here in attendance today, Chairman Ann Rollins. And any other of the HHS board members, if you would please stand. Lily, I see you. And, okay, oh, Wanda, I didn't see you. And Wanda is our vice chair. Okay. So, since joining Team Wake in 2020, My team and I have had a goal to service offered by county that would be easy for our staff, for our community to come into. In the past, as an attorney, advocating for children and families, and as a mom of a child who had seizures and went through brain surgery, I personally witnessed the importance of public health and social services working hand in hand. This new public health center is an important step to doing just that. Residents will have a centralized hub where they can access a wide array of health care and social services in one place. And as you can see, we're very neatly co-located to our Swinburne building, which is where our social services are provided. This gives us an opportunity to make accessing our program services more convenient for individuals and families who need them. Currently, a person with a medical appointment at our public health center who is also looking for financial assistance has to make separate appointments and travel, usually by car, by a bus line, to our social services building to find out what they might be eligible for. Once the new public health center opens, these services will be available on one campus, and our employees will be ready to help connect families and what they need with just one trip. For example, a mom and dad coming to get services for their children at the health clinic, or a mom who's receiving WIC services will also have access to Medicaid and SNAP benefits, for example, financial assistance if needed. By fostering a collaborative and comprehensive approach, we aim to enhance the overall health outcomes of our residents with a particular focus on those facing socioeconomic challenges. If there's one thing, and there's more than one thing, that we learned from COVID, it's that public health plays a vital role in our society and touches us all. Terms like epidemiologists, contact tracing, and outbreaks became a term within our normal conversations. But this is just the tip of the iceberg when it comes to public health. In times of crisis, public health becomes a shield against the unknown. When facing pandemics, natural disasters, or other health emergencies, a robust public health infrastructure is our first line of defense. It enables us to respond swiftly, mitigate the impact, and protect our most vulnerable members of our community. It is an investment in our future. Healthy individuals are more productive, and healthy communities are more prosperous. By prioritizing public health like we are today, we are laying the groundwork for a society where everyone has an opportunity to flourish and to reach their potential. But none of this would be possible without the dedicated staff who make our public health team, who I just mentioned. I'm the forefront, but you know what? Where the rubber hits the road, they are the ones that make it happen. While we're excited about this new campus, it's our people and their passion for the work they do that are the backbone of making sure every one of our residents have access to care and the services they need. The healthcare professionals, administrators, and support staff are the heart and soul of this facility, and their dedication, compassion, and expertise will be the driving force behind the success of our new center. As I envision the future of the Public Health Center, the words of Commissioner Dr. West echo in my mind. He used to emphasize that while he might not have been high-tech, he certainly was high-touch. So this philosophy reflected his understanding of the importance of engaging with the community directly, meeting people where they are. In many ways, I see our new center as a perfect blend of these principles. Yes, we will embrace cutting-edge technology, ensuring that we remain at the forefront of healthcare achievements. But embodied within this commitment to progress, we will preserve the high-touch ethos inspired by Dr. West. Our approach will remain personal, compassionate, and community-focused. We will strive to reach individuals and families where they are, both physically and emotionally. The legacy of Dr. West's philosophy will endure in our dedication to addressing not only the physical needs of our community, but also the social determinants that profoundly impact us all. So thank you all again for coming today and being a part of Wake County's future. And now I'll turn it over to our awesome chair, Thomas, to close us out.
Thank you so much, Nanette. We are so excited to see the great work that you and your team and our partners will do when the center opens its doors. I do want to take just a moment and acknowledge, recognize two of our city councilors that are here today, Corey Branch and Megan Patton. Thank you all for coming. And thank you all for helping us celebrate this accomplishment today. I cannot wait for the day that we're back here together touring this new public health center. So now let's officially get this ground broken. Speakers, will you please join me back here with our hard hats and shovels right this way?